Hey y'all, welcome to the Standing on Business podcast, where ambition meets action. From career moves to life lessons,
our podcast is dedicated to supporting you as you navigate both the personal and professional growth journey.
Ultimately giving you the confidence to always stand in your truth. Welcome back to the Standing on Business podcast. I'm your co-host, Amari.
And I'm Bianca.
And today we're super excited to be joined by our guest speaker, Dr. Brian Pettiford, a leading figure in thoracic surgery and an inspiring example of excellence within healthcare leadership. During this episode, we'll be diving into his journey into medicine, his insights on balancing clinical and corporate life, and advice for the next generation of medical professionals. So, Dr. Pettiford, welcome to our podcast, and thank you for coming.
Thank you for joining us.
Thanks for having me.
So, Dr. Pettiford, we're excited to have you here, and we definitely want to get started with what we like to do here is tell all of our guests to give their elevator pitch. So, give us a little bit about yourself. Tell listeners like who you are and what you do.
Okay. Well, first of all, good afternoon. I'm Brian Pettiford. I'm a Tifton, Georgia native, small town in South Georgia. I have to give props to my hometown. I was educated in the public school system. Very proud graduate of Morehouse College in Atlanta.
HBCU.
Yeah, absolutely. Also a very proud member of the mighty Omega Psi Phi Fraternity Incorporated. Got to put that in there. But I left Morehouse, went to the University of Pittsburgh, where I obtained an MD degree, and trained in general surgery and cardiothoracic surgery there. During my 22nd year in practice.
Congratulations.
So
that's amazing.
It's been quite a journey.
I love that.
That's amazing.
Yes.
I was going to say, that was a really nice intro, but I think that we can go a little bit deeper into getting to know you. And so I have a couple icebreaker questions. So what has been the most surprising thing about leading in the healthcare industry that you did not expect when you started?
I think, and this is probably more disappointing than anything, is the corporatization of healthcare. I've been around long enough to kind of see the transition from a more outcomes and frankly, patient-centered healthcare delivery to now there's an equal, at least in my observation, and I think many of my clinical colleagues, their respective observations, you have to kind of look at the bottom line, so to speak. And so that's, there's a certain degree of realism to that. You have to be realistic. You have to pay the bills. But it can be a bit of a challenge.
No, that's understandable because essentially that's what keeps the lights on for you to do the actual work. So, no, that makes complete sense.
Yeah, and I would say, like, as I started out clinical as a nurse on the floor and seeing that, it made me want to go into the business side of healthcare just because I wanted to make, I guess a broader impact, and then also, like, have that lens of that nursing perspective, like me, like, taking care of patients, like, no, if you actually change this, you're impacting, like, so many more things than, like, sometimes with if you just have a corporate experience. Sometimes they don't know. So they need the clinical side in the leadership. So
it definitely does affect the downstream.
Yes.
And so with that, I guess going a little bit deeper, knowing what you know today, what's one thing that you think that both clinical leaders and just clinicians in general should be prioritizing within like the next 5 years?
Well, I certainly think first and foremost, most of us, if not all of us, we went into medicine to basically take care of people. And so you have to be an expert in your respective field. So absorb all that you can, starting at an early age, and certainly as you engage in your medical education. Become an expert, but one thing that is not taught in medical school is the business side, the financial side. And so get some rudimentary understanding of the business side of medicine.
No, and then especially as you talked about, like you said, like you currently, your role, you've been in it, you're practicing for 22 years. You're a surgeon currently, but let's get to where you started and do our from point A to point B segment and really get to know, like, what made you even get into medicine. You talked a little bit about college. And then how do you, even get to this role, which I know you've gone through lots of schooling. So tell us about all of that. And also you said patient care, but like what else is your why?
Yeah. So it frankly started at an extremely young age. First of all, my mother, when she was working, she was a licensed practical nurse on a surgical floor in our local community hospital. My father, his father, and several of my family members were auto mechanics. So there was nothing that was broke that they couldn't fix.
I love it.
And between my mother's stories and just hanging out with my father and my paternal grandfather at the service station and helping them fix things, and it all really started with the death of my maternal grandmother. My mother, they were extremely close, and she had a heart attack. She had a stroke first and then had a heart attack, and ultimately died all within 1 year. And I was in the third grade when it happened, and vividly remember the pain on my mother's face as her mother was buried. They were best of friends, and that kind of, I was always intrigued, what about Granny's heart was so important that she got sick and ultimately died. And so that kind of generated a very naive interest in medicine. And as I got older, in junior high and high school, I kind of cultivated that interest through programs like Upward Bound. I participated in several summer science programs over the course of my education, both in grade school as well as college.
Can you tell our audience what Upward Bound is?
Yes, it's one of those, I guess, now bad programs, but it's a program that prepares mostly minority kids from underserved backgrounds for college. It exposes them to college. To give you an idea, some context, I distinctly recall one of my high school classmates, a man brother that I grew up with, literally went to Head Start with. I remember him sitting, we were taking the SAT, and he got up a quarter of the way through the SAT, chuckled, walked up to the proctor and turned in his test, walked out. Yeah. And, we all thought it was kind of hilarious at the time. But as you mature and you think back on it, a program like Upward Bound exposed me to the importance of taking tests like the SAT. I was able to have my first HBCU experience. I went to Fort Valley State University on a site visit, a group of us, and that was through Upward Bound.
Okay.
So, so it's an important program.
Yeah, sorry, I didn't want to stop you in your story, but also our audience, we really want to tell them what these programs are so they can go research. Listen to this and go research for their own, what these programs do. So thank you.
Just being able to take it and run with it. No. So I also really appreciate just your vantage point on your why. I think I always say, a career in healthcare isn't about a profession, it's about your purpose. And I think a lot of times that is born through, a painful event or something that's adversarial, and you find a way to alchemize that pain into purpose and transmute it into something that's positive and productive. And I love that you touched on that. And I'm sure that you had a lot of journeys, to get you to where you are today. And with that, we talked a bit about how you got into medicine and being clinical. But once you got there, you realize, I think I could do a little more. You decided to push yourself even further. And so I want to know, what was your why behind going into healthcare leadership and administration, and what was that transition like? Because once you knew you wanted to be clinical, that came from the heart. But it was a more thoughtful and strategic, maybe, process for going into leadership.
Well, my first love from a career perspective is still the clinical side. I think you make the greatest impact when there's relief on a family member's face or a patient's face that you've been able to help them. There's nothing more gratifying than that. But also, surgery is extremely physically and emotionally taxing. It does a number on you. And you have to always think about Plan B. What is Plan B going to be? And as I mentioned, I have been able to witness the evolution of medicine where there's certainly a business side of it that, unfortunately, when we were being educated, that was never, ever alluded to. And so I have to realize that, hey, look, I'm a surgeon. I consider myself an expert in my field, but there's going to be a time when I cannot do that anymore.
Yeah.
And also, how can I better communicate with our administrative colleagues, and having some degree of an administrative background can kind of help me to better serve as an intermediary, not only between my clinical colleagues, but also the administrative colleagues and even the patients.
Yeah, we talked to Deborah Grimes earlier this year, and she, she also started as a nurse in the clinical side and then switched over, got her JD, MHA. Deb has it all the things.
Doesn't she have is the real question.
And that was something she cited too of like, I can't do this forever, so how else can I make an impact?
Exactly.
And, obviously not she is Deborah Grimes. She is the
Deborah Grimes. No, I love that too because you're just adding to your repertoire and diversifying your professional portfolio, which is great because you are not a monolith, like you are diverse and multifaceted, and so it allows you to be able to flex different versions of who you are in the best capacity while also inspiring others to do the same. But with that, I'm sure it's not an easy feat to balance everything, with you being a leader, both clinically and administratively, but also just in your personal life. Like you mentioned all of the things that you do as the Dr. Brian Pettiford. And so I guess one, more formally, because I don't think a lot of people understand that there's like a true FTE split between I have this much time designated to be, patient-centered or this amount of time to be administrative. And then just in general, like how do you balance that with your family? So I guess my question is, do you mind giving an overview for our audience of what it looks like for you to manage the duality of patient care and administrative responsibilities just on a day-to-day?
Sure. Well, it varies. And again, my overwhelming majority of my time is spent on the clinical side. But as a section head of general thoracic surgery and serving on several committees within the hospital, there's certainly a clinical side, an administrative side. But clinical responsibilities by far are more important and have a higher priority. But it varies. For example, yesterday I woke up at 5 a.m. I had a 7 a.m. case. It was a major robotic surgery, so it took a while to get the case going. This person had a complicated problem. Had gotten some pre-treatment with radiation, created a lot of scarring. I got out of the operating room at 8:30 last night.
Oh my gosh.
Stayed in my office working on some administrative stuff. I think I may have gotten home at maybe 9:30, ate dinner at 10:15, and woke up at 5-something this morning. And it's kind of rinse and repeat. Now, a day like yesterday, I did not have much time for anything administratively because I was up to my ears with surgery. There are other days where you do engage in administrative tasks, and a lot of that has to do with managing people, which can be extremely challenging.
Oh, yeah.
Probably more challenging than any of the clinical stuff that we do. And a lot of it is just a matter of dotting all I's, crossing all T's, making sure that you are a responsible steward from a financial perspective. So thinking about, hey, how will my decision right here affect our bottom line, for example?
Right.
Yeah.
No, and that's a good segment to like asking you, like with the corporate goals, like we know you have different metrics that you have to always look at as a leader. So how do you really make sure they're aligned with, a patient-centered approach, like as you're leading your team?
Well, some of it, the bulk of it is, hey, I need to do what's right for the patient. I need to also do what's right for the way I was raised. And so, yes, I have to consider the administrative/economic side of many of the decisions that I make, but never, ever compromise on patient care, patient outcomes, and what's just doing the right thing. And quite frankly, common sense.
But common sense isn't common, so that's a great point to make.
Yeah. But for example, sometimes during surgery, you're at a point where do I use this instrument or not? Because this instrument, if I literally touch the patient with it, it's $2,000.
Yeah.
Is there a way that I can perform this surgery and not use that particular instrument? Oh, there are multiple surgeons in our section. Well, guess what? We need to kind of streamline things, and we all use the same equipment. Using the same equipment when you're working with a vendor, guess what they're going to do? You're using more of it in bulk, they're going to give you a lower price. So that's kind of the viewpoint, the approach that you have to take.
I was saying, how do you teach your teams or people coming up under you like that same like mindset?
Well, I think when you explain it to them that way, And you also tell them, look, you can do it the way you want to do it, but here are all the hurdles that you're going to have to jump over. I think that will give them pause, and they will be a little bit more willing to comply with what you're recommending. And it's not easy. A lot of us in medicine, we're creatures of habit. You're used to doing things in a certain way. You're trained to do things in a certain way. And it can be a bitter pill to swallow to kind of have to change your approach. But that's life.
Yes, I'm sure you've seen a lot over your career, just in that of like, because I've worked with surgeons before, and it's like, I want this particular item, and both me and you with operations, management, and like, this isn't here anymore, and like, and it's like, hey, we had to optimize and be more efficient, but we still are caring, we want to focus on patient care and give you the best,
Yeah, as long as if it's not a patient safety issue where the device or medicine itself poses a risk to the patient, or the operator of it, the surgeon feels that he or she is incapable of using it to its maximum potential, where he or she feels that it is a risk to the patient, then hey, look, we'll consider it. But if we look at something and we're going to compromise on patient care, by all means, it has to be a two-way compromise.
Dr. Pettiford, you made a good point in your discussion, too, in talking about how you lead your teams, how mentorship plays such a vital role in medicine and leadership. But I kind of want to inversely ask the question that Bianca just touched on and get more into the people who mentored you and your guiding lights and hands. And so I want to ask, who were some of your mentors and how did you connect with them, and what impact did they have on the trajectory of your career and helping you be the person that you are today?
Well, I had mentors at several levels. Didn't just start when I was in training or in medical school. Going back to literally as a child. It started with my parents, my grandparents, seeing the sacrifice that my parents made on my behalf. That certainly had a positive impact. The staff at Upward Bound. They were extremely influential in my decision-making process to go to college and where to go to college. Once I was in college, our head of our healthcare professions program, Dr. Thomas Blocker, interestingly, he passed away a few years back, and even more interestingly, he was in medical school at Emory University. Graduated Morehouse in the 70s. Went to Emory. Flunked out. Failed.
Resiliency.
Yes, it's okay.
It's okay.
Yeah, you pivoted.
You can always bounce back.
But he came to Morehouse and was a professor in the biology department, headed our health careers program. At his memorial service at King Chapel on Morehouse's campus, they asked all of the doctors, dentists, and chemists who were educated under his watch to stand up. And I tell you, there were at least 200 brothers that stood up. Wow. Okay, so he had more of an impact by flunking out of medical school than he would have had he been a physician. So I consider him a strong mentor. And I had also had mentors throughout my residency training. One of them was a doctor named Dr. Peter Fersen, and another one named Dr. Henry Bonson. They were two older white gentlemen that took me under their wings. And I have a picture of both of them in my office looking over my shoulder at my administrative desk.
Wow.
Yeah.
That's such a great grounding reminder of like, wow, this was a great connection that has kind of helped to forge and foster where you are today. I love it.
I love it too. And then as you talked about your mentors and you talked about especially like the programs you've been in, Morehouse, you had lots of representation of Black excellence, Black men. I would say as you've gone into the, your workspace, the healthcare industry, especially now you're in a specialty, like I'm sure you're one of the, like your top few Black men in like what you do. How has representation or underrepresentation affected your career or just affected, what you faced in your career?
Yeah, that's an excellent question. I was the third Black graduate of the general surgery program at the University of Pittsburgh. I was the first to finish their cardiothoracic surgery program. And over the years, you find that you're often the only spot in the room, so to speak. And you realize that you have to always dot all I's, cross all T's. You watch the way you speak, the tone of your voice. It's a challenge, and it's certainly not going to get any better in the current environment. What that has done for me is to make sure that if I have a young African American, black or brown, or heck, yellow or white for that matter, anyone that comes to me seeking mentorship, I'm going to have an open door policy, because I know I didn't do this by myself. Be it someone like those two surgeons taking me under their wing, or some older grandma in my church praying for me unbeknownst to me. I know that someone was out there helping me out, and so I have to pay it forward.
That is good, because I think we both have talked. We talked with Dev, like I said earlier this year, but the mentors. Like, I've done a few programs throughout my life that have definitely shaped my career, and the mentors and people who were in those programs really have taken my hand and got me to where I was today. So.
Yeah, no, and I think another thing to consider is the fact that there's still so much work to do.
Right.
And I know that you touched on a little bit of like the concept of diversity, equity, and inclusion can be polarizing. There's a lot of discourse around it, but ultimately it is necessary. In order for us to be the best, you need that enhanced perspective from everyone. And so I guess with you being in the field that you're in and it being very narrow for someone who looks like you, what actionable steps do you think that institutions and organizations can take to improve diversity in fields like thoracic surgery?
Well, it's a challenge. It was a challenge before, and starting next year is probably going to be even more challenging, and it's a shame, definitely a shame. One thing that the thoracic surgery, some of the governing bodies within thoracic surgery has done, they've had programs like Women in Thoracic Surgery, because it's not just related to race. It's a field that has a relatively paucity of women, and so there's been an initiative to try to recruit more women in thoracic surgery. But along the African Americans in thoracic surgery, first of all, I think the figure is 5.2% of all doctors are I think black, and then black men is probably an even lower subset of that, because if you look at things now, more women across the board are going to college.
Right.
And you got to crawl before you walk, so you can't get into medical school until you go to college and graduate college. So you can imagine that the rates of black men in medicine is even lower. And then when you're talking about going into thoracic surgery, it's even lower. The training is longer.
Right. Your fellowship programs.
Well, you got to do general surgery training. That's 5 years. Then you have to do another 2 to 3 years of cardiothoracic surgery training. And during that time, you're not making six figures. Everyone has this misconception that the minute you graduate medical school, you're making six figures. It ain't how it works.
The beginnings are humble.
Yeah, and so very humble. And when I trained, we did not have work limits. We easily worked between 100 and 110 hours a week.
Oh, my goodness.
Yes, and so you have to ask, a lot of people will ask themselves, do I want to do that?
Yeah.
And graduate with a mountain of debt. And so I think that may have historically and even currently will influence people's decisions about what specialty they're going to go into, or whether or not they want to specialize in general. I didn't come from a lot of money. A lot of folks don't come from a lot of money. So you go to college, and then you have a medical school debt that has accrued. You have to be pragmatic. You have to be realistic. You may want to have a family. You may have a house. And now you have a mountain of debt. So that can motivate people to maybe not go into specialties like thoracic surgery or neurosurgery or orthopedic surgery that requires an extended time period of training.
Have you found any resources, as I'm sure lots of people come to you, like for wanting to go to medical school, or maybe they're in medical school now, like, have you found any resources that you recommend for when they're making the decision of like what specialty I want to go in?
I would say shadow someone, ask someone. And one other person I failed to mention, and I actually feel terrible. I have a cousin, second cousin, he was a few years ahead of me. We grew up together. His mother and my grandmother were literally born 6 months apart as first cousins, and he took me under his wing. And I remember he was a counselor in Upward Bound. And when he was getting ready to graduate medical school and went to his residency, he took me with him on a road trip as he moved into his apartment. And so I got that exposure. But the point is that if you see someone, just go up and ask that individual. The worst thing that they can do is say no, okay? But you won't know if you don't ask. And if they say no, go to some, eventually all you need is one yes. Even when you are applying to college, if you are applying to medical school, if you don't get into one school, it's okay. All you need is one yes. If you apply to 10 medical schools, you can only go to one anyway. So
That's
get
correct.
that one yes, and when you get that one yes, take advantage of it.
No, that is great advice. And I know there's lots of people trying to see, what path do I want to go down? Like, especially for high schoolers. I know we're about to get into that of like people who aspire to be clinicians. So.
Yes.
Yes. No, and with that, you make a great point of, a lot of people don't necessarily, they're intimidated by, just looking at the mountain that is healthcare, especially on the clinical side. But that doesn't mean that it can't be done. It just means that it starts with you, and it's for you to go out and be the change that you want to see in the world. And so with that, I love that throughout this conversation, you're not just giving our audience, oh, this was my journey. You're also giving them the to-dos of like, hey, here's the blueprint if you want to do this. So I guess my question is for high school students or college age students who are interested in medicine and think that they want, to become a doctor, what experiences aside from shadowing would you recommend that they pursue before applying to medical school?
Sure. First of all, medical school has become increasingly difficult to get into. And so you have to realize that, hey, look, I want to go into medicine. I can't mess around in college. You got to make the grade, okay?
Yeah.
I'm not saying you have to have a 4.0, but you can't have a 2.2 either, okay? You have got to study your butt off. Whether you believe it's fair or not, there's something called standardized tests. You got to take standardized tests in order to get into medical school. There are additional tests that you take in medical school that will kind of dictate what type of residency you get into. Take those tests seriously, study for them. For getting into medical school, there's something called the Kaplan course, okay? It's a course that prepares you for the MCAT. Spend the money to take it, okay? If you can spend the money on a case of brew every weekend, you can save up and spend money to take the Kaplan course.
Yeah, it's an investment.
Yeah, it's an investment, and you take the questions ad nauseum, and that coupled with the grades, and if possible, participate in the summer program where you can kind of nurture your interest and kind of create something that when you do interview for medical school, the interviewers will look at you, and that's a nice topic for discussion. Hey, tell me about your experience in the summer where you worked on this research project. It also helps them to remember you when they're looking at a group of applicants. They can say, oh, hey, look, this person here, she went to this program, and instead of spending the summer surfing somewhere, she was actually engaged in a summer enrichment program.
So seek out
And
experience.
absolutely, and it sets you apart.
No, I love that because I think to your point, gaining that hands-on experience is a differential for you, right? When you're in a pile of applicants and it's like, well, what makes you stand out? But also it's beneficial for you. It helps you build your own understanding of, is this what I want to do? Do I like this? Or I think that I like it in this format, but maybe I need to be a little bit more niche. So for me, I thought I was entering my career, I was going to be clinical. I thought I was going to be a physical therapist. I wanted to save the world and be a fixer, like you mentioned earlier. And then I tore my ACL my senior year of college and was like, I don't think I want to do this anymore. But what that birthed was my love for the administrative side of healthcare because I'd gone through just some pretty bad outcomes, and I was like, I want to make my change here. And had it not been for that hands-on experience with me going through that, but also volunteering at my PT clinic, I don't think that I would have had that foresight to say, you know what, let me make this change now because I don't foresee this being something that I want to do forever.
I was saying, it made your experience, it made you, where you are today. We talked about the high school students, college students, and then as Amari said, now we're going to talk about clinical, current, who's in residency, fellowship, the people in their career. What advice would you have for them if they aspire to be in leadership in healthcare?
Same deal. You have to do extremely well on the clinical side. It gives you some degree of credibility once you enter the administrative side. of things. And certainly, I find that sometimes people will look at you and maybe, due to some things, dismiss anything that you might say. So one thing that can provide some degree of credibility is going out and doing like Deb Grimes, getting those degrees. That's something I did. I didn't get a JD like Deb, but I went out and was able to get educated, and that gives you some degree of credibility. Start serving on some committees. Don't overwhelm yourself.
Yeah.
Again, early in your career, you need to focus on becoming an outstanding clinician. Make a name for yourself as an expert. And then as you want to gravitate towards the administrative side of things, maybe enroll in either some type of a certificate program or just go and get an outright degree, be it a master's degree or if you want to go and get a doctorate degree.
Okay, great. That's very pinpointed advice.
It is. And I love it because I think also, too, it kind of leads into how you build your community, right? Like going back into the mentorship piece of it all of like you need like-minded individuals who are wanting to support and kind of move in the same direction to help you reach your goals. Because to your point, it's that fire and intensity has to be inside you. It's intrinsic. You have to be intrinsically motivated. And if you're not around people who also have that same like fire in their bellies, you don't know how far you'll go. Like it may be a little bit more difficult to get there because the people around you are your distractions as opposed to like your propellers.
Yeah, you want to find the right people.
Yeah. So with that, I guess, how do you suggest that people who are in clinical roles find the right networks to support their ambitions? Because I think a big piece of making that transition is the visibility and the support and sometimes even the sponsorship. So once you've done all of the things that you've mentioned, like kind of how do you brand yourself and find the right people to help you get to that next step?
Well, you look at some of the individuals who are already doing it. There's no need to try to reinvent the wheel. Go to them, ask them, request a meeting, and express an interest in transitioning to an administrative side of things and kind of get their advice on what needs to be done. And look, if you decide you want to go into take on more of an administrative role, it's not like you're going to become a hospital CEO overnight. You have to crawl before you walk, okay?
Yeah.
And so you probably are going to have to serve on a committee or something of that nature and demonstrate that you're, number one, capable of regularly attending and being making tangible contributions to whatever topics and initiatives that the committee is engaged in. And with that, you'll get more responsibility heaped on you. And then the challenge is juggling all of that with your clinical and personal responsibilities.
Yeah, but you've already given them the how-to. You've already given them the gems from, the greatest. So they should be able to take it and run with it, I think.
Yes.
So.
I feel like we've gone through all the stages. This is a great way to from those just even somewhat thinking about medicine if they're in high school, even middle school. I don't know, podcasts are very popular today.
Yeah.
So,
but I mean, think about it. We knew that young, so we can't discount them.
Yeah, no. So it's like from all gambits, you've been able to give some great advice and great insight. So I hope that I'm pretty sure that you have encouraged somebody to go into medicine after listening to this episode.
Yes. So again, Dr. Pettiford, we thank you for coming here and carving out time from your super busy schedule to meet with us and speak to our audience today and inspiring us. I feel like I took away so much of this of like, maybe I should start applying these concepts in my life to be a little bit more successful. So thank you so much for that. And before we go, do you mind just sharing how our listeners can connect with you or learn more about you?
Sure. Well, I'm the section head of thoracic surgery at the Ochsner main campus, Ochsner Health System. My email address is Brian, BRIAN, .Pettiford, PETTIFORD, at Ochsner.org. I also am on LinkedIn. I'm kind of old-fashioned. I'm not on Facebook, and I'm not going to get on Facebook. I don't have a Twitter
do the work
account.
if you want to connect with them. So do the work.
Yeah. So, but I'm fairly busy, but I'm also pretty responsive. And certainly, if there's someone who has an interest in coming out, kind of seeing how things are done, and they have an interest in medicine, again, that is my way of paying it forward. Someone did it for me, so who am I to not do it for someone else who shows an interest?
I love that. Yes. I love that. Also, I forgot to ask this, so I want to ask before we go. You've given a ton of gems today, a ton. But if there was one piece of parting advice that you could give our listeners that you feel like everyone should know, what would that be?
We all have bad days, but on your worst day, remember that someone has it even worse than you, okay? Someone didn't wake up. You did. Someone woke up, but one of their life's partners didn't wake up. So always put your situation into perspective. I know it's not easy. It's not easy for me, but on your worst day, there's still a blessing in it. It's up to you to discover that blessing and appreciate it.
I love it.
Thank you. I received that.
Yeah. I was going to say, that is applicable to me right now.
Yes. But we want to thank you again for joining us.
My pleasure. Thanks for having me.
No problem. And to everyone listening, we hope you found this conversation as inspiring as we did. And don't forget to follow us on Instagram at standonbusiness.pod and listen to us wherever you listen to your podcast. And thank you so much for tuning in. Bye.
Bye, guys. See you next time.